Good afternoon, dear patients. Today, we will discuss the topic of itching in the pubic area. A patient came to see me with itching in the pubic area who had red spots on his pubic region that he had noticed himself. He would periodically apply these spots with various glucocorticosteroid ointments as prescribed by doctors, among others. However, for probably the last few months, he hadn't visited any doctors. So, as he was prescribed hormonal ointments at the dermatovenerologic dispensary, he would occasionally apply them. However, the itching often did not go away despite these applications. Sometimes there was even a burning sensation in the pubic area. And upon close examination, there really were areas of redness, red spots in the pubic region. And along with the red spots, we also noted the presence of blisters. There were blisters with clear fluid, with purulent fluid. Sometimes they were small blisters, which were often grouped together. Naturally, against the background of the red spots, as you can see in our illustrations. Accordingly, the patient was first tested for allergies. At the dermatology clinic, of course, these tests were not performed. He was diagnosed with dermatitis just by visual inspection. You can find more details about allergy testing in a separate video on our channel. In short, this includes immunoglobulin E, a complete blood count, circulating immune complexes, eosinophilic, cationic protein, and so on. And then, as described, tests were taken from the surface of the rashes for herpes, various types of herpes. At the very least, tests were taken for herpes simplex virus types 1 and 2, as well as for shingles or herpes zoster. This is a PCR test, a scraping from the surface of the rashes. As a result, elevated levels of immunoglobulin E, the main substance involved in allergies, were found, as well as elevated eosinophils, the primary cells involved in allergic reactions. And in addition to this, positive PCR test results for herpes simplex virus type 2 or genital herpes were obtained from the surface of the rashes. Fortunately, these rashes were localized not directly on the penis, which would have caused this man much greater suffering, but specifically on the pubic area. Accordingly, first of all, an immunogram and a general analysis were prescribed. A general blood test was conducted, yes. An immunogram was prescribed, although it should be noted here that, unfortunately, an immunogram only starts with a general blood test, so it was repeated for this patient. What was prescribed? Step-by-step therapy. To start, sodium sulfate, calcium gluconate, antihistamines were prescribed accordingly, and antiherpetic drugs were also prescribed, for now in tablet form such as Valver and Valtrex. Later on, there was a noticeable improvement. Why? Because, initially it turned out that there were two diseases. It was a combination of genital herpes. By the way, I forgot to mention that blood was also taken and positive IgM immunoglobulins were found, which indicates the activity of the process in this case, though probably not its recent onset. And also, accordingly, a combination with an allergy. If we eliminate one of the factors, things already become significantly better. Later on, the patient was referred to an immunologist, where immunocorrection was carried out according to the immunogram. You can also watch a separate video on our channel for more details about herpes treatment, so we won't go into that now. The takeaway from this video is that quite often doctors or even the patients themselves prescribe hormonal ointments for themselves without any tests. Even if you are diagnosing an allergic reaction without considering herpes or anything else, you should at least do the minimum tests for this allergy, whether it is present in your blood or not, whether you need any systemic treatment, whether you need additional tests for food intolerance or other allergy tests or not. The use of ointment, especially if it hasn't helped after, say, 7 to 10 days, definitely requires a mandatory visit to the doctor and a more thorough examination. Unfortunately, many dermatology patients do not understand this, or when they feel a little better, they stop everything, forget about it, and continue to suffer, further chronicizing the process in their bodies.